Yeah, Mr. Akilan, he is a young 45-year-old Indian. He was working in a company and he was diagnosed to have Parkinson's disease about 7 years ago. Since the time he has been started on medications. Initially, he used to get good response with medications. That means his stiffness of the limbs, his tremors, all that used to improve significantly, and he was back to his work and he was able to manage at work. Progressively, over a period of 2 to 3 years after into the illness, he started developing severe side effects of the medicines which are used to treat this Parkinson's disease, and namely dyskinesia. What is this dyskinesia? Is basically a very abnormal and twisting movements of the head and neck that happens in these patients when they get these on periods. So he could not go to his work. People thought that he was malingering and he was doing all these movements just to gain sympathy, and he had a very troubled social life. And because of this severe side effects to the medicines, he had to leave his job and then be at home. So when he came to us, he was already in this advanced stage of illness of Parkinson's disease, where he had severe side effects of the medicines and also had significant off periods. He had main problem for him was this abnormal movements of the neck and the hand, the twisting movements, and also inability to walk. That means he used to get frozen, his feet used to get stuck, and he could not get up and move fast. So we assessed him like we always do for all these Parkinson's patients. We did a detailed evaluation, and because he was young and he had such a long life to live ahead, we offered him this surgery called deep brain stimulation. He underwent this surgery about 2.5 years ago, and since then has been really doing well. His side effects have significantly reduced, like because after the surgery the doses of medications are also reduced, and so once the doses of the medicines are reduced and he gets a good on phase, which means he's able to walk better without severe medicines, the side effects also have reduced. Because of this freezing of gait, which was his main problem, which I said, that means his feet get stuck to the ground, we had to use a lot of innovative programming, which is also a very new and interesting thing that we have found out over a period of 5 years since we have started this program, and have gained more and more knowledge and experience in treating these patients. So in this particular patient, we used that knowledge and we used what is called as a low frequency stimulation. Traditionally, what we use is a high frequency stimulation, but because this patient had a very difficult gait problem which was difficult to treat just by giving high frequency, we offered him this low frequency stimulation, and that has achieved the kind of results that we wanted. So right now he is able to walk very easily, he doesn't get so much freezings, and his side effects, that is the twisting of the neck and the abnormal movements of the hands that he had prior to the surgery, has significantly reduced. And he feels that he should not have left his job. If he knew about this therapy, he would have definitely continued this job and would have taken the therapy at a much earlier stage. So we at Columbia Asia are also trying our best to reach out to all the patients who are suffering from Parkinson's disease, educate the general people about the kind of treatment options that are available, and it's not that once you have this disease and there is no solution for it. So that is also has been a very important part of our educational or training program, or reaching out to these patients with Parkinson's disease that we do at Columbia Asia. Thank you.